Hello, my name is Melinda Wu. I am a pediatric endocrinologist at Johns Hopkins. People with cystic fibrosis are at high risk for fragility fractures, with 1/4 of healthy adults with cystic fibrosis having vertebral compression fractures, which is an osteoporotic fracture. National guidelines recommend screening all adults with CF for osteoporosis with a DEXA scan at least once every 5 years. However, nationally, only 60% of adults with CF are screened, and 65% of adults with CF at Johns Hopkins are screened. Furthermore, compared to healthy peers without cystic fibrosis, children with CF have slower rates of bone accrual and reach a lower peak bone mass. National guidelines also recommend screening children 8 to 18 years old with risk factors for CF, bone disease. These risk factors are poor lung function, being underweight, chronic glucocorticoid use, delayed puberty, and a history of fractures. At the Johns Hopkins CF Center, we are working to improve the rates of screening for bone disease in children with CF. At the 2024 North American CF Conference, undergraduate student researcher Sophia Harrison presented our data that 37% of children 8 to 18 years old followed at our pediatric CF clinic in 2022 should have been screened for osteoporosis with a DEXA scan, but none had completed the screening in a timely manner. Because the most common reason to need screening was a history of fracture, we reviewed the medical records for details about the fractures experienced by children with CF. Of the 70 fractures reported in 52 children with CF, we found that the median age for fracture was 10 years old. The most common site were the long bones, but fractures occurred in all body parts, including the spine, which would be concerning for pediatric osteoporosis. Our baseline data highlight the need for improved screening for osteoporosis in people with CF, particularly children. Low screening rates leave people at risk for delayed diagnosis. I want to thank my research team and collaborators in the Johns Hopkins CF Center, including Sophia Harrison, Sarah Molina, Lynn Bosboos, Janet Crane, Peter McGazel, and Scott Blackman. Thank you for listening.